Okay, let's unpack this. We are diving deep today into a field that I think for a lot of people sounds almost too good to be true. Music therapy. But we're going way beyond just, anecdotal stories or having some calming background noise. We're looking at the hard clinical and neurological evidence that supports using structured music for some really massive health challenges. We're talking anxiety, depression, dementia, even chronic pain.
That's absolutely right. And the sources you shared, they really focus on getting past that sort of feel-good factor.
Hmm.
The whole goal here is to understand how the brain is actually responding. What's happening chemically, what's happening structurally, and maybe most importantly, where is the evidence strongest in the clinic? We want to give you a clear map of this therapeutic landscape.
So that's our mission today. We are mapping that landscape. Can these structured, evidence-based music interventions really provide a viable, low-cost and low-risk option, an adjunct treatment for these huge mental and physical health issues? We're really trying to understand the mechanics behind the music.
And to do that, we have to start with the professional groundwork. Because music therapy, it gets confused a lot with just putting on a calming playlist, but it is a really rigorous clinical practice.
So let's define it then. What's the official benchmark for the field?
The American Music Therapy Association, or AMTA, defines it as the clinical and evidence-based use of music interventions. And these are used to accomplish individualized goals, all within a therapeutic relationship with a credentialed professional. That credentialing part is, I think, the first big takeaway for you.
Why is that certification so critical? What does that signal?
It signals rigor and, frankly, safety. A certified music therapist, they have the letters MTBC after their name, has gone through specialized education. They've done extensive clinical training. We're talking a minimum of 1,200 supervised hours.
Wow.
Yeah, and they have to hold a current board certification. It's what separates us from someone who, just uses music intuitively. It's a very demanding profession that's focused on getting measurable results.
That distinction is so important. So when we talk about these interventions, the sources you sent break them down into three main categories. What are they?
We basically group them by how much the patient is engaged. So first you have active music therapy.
Active. Okay, so the client is actually creating the music.
Exactly. They're improvising, songwriting, maybe singing or playing an instrument. The benefit there is often deeply psychological. It really enhances self-expression, self-worth.
Yeah.
It's a powerful nonverbal outlet.
It's about creation and ownership. I get that.
Precisely. Then the second type is receptive music therapy.
So just listening.
Listening, yes, but it's done within that therapeutic relationship. So it often involves the therapist guiding them, maybe through guided imagery or a deep dive into song lyrics. The goal is to help them process emotions or memories.
And the third one, this is what really separates the clinical side from everything else, right?
That's right. It's called music medicine. This is where patients are simply instructed to listen to music. It's often pre-selected, and the focus is purely on the direct physiological effects. So, say, listening to a specific frequency while you're recovering from surgery. It's independent of any therapist relationship.
Okay, so that framework is super helpful. Now let's talk about the engine driving all this, the brain. How is music physically processed? It's obviously not just a simple sound cue.
Not at all. I mean, music is one of the most complex stimuli that we know of because it's not processed in just one spot. It activates the auditory, the limbic, which is your emotional center, and your motor networks all at the same time. When you hear music, your whole brain just lights up.
It's firing across multiple domains at once.
Exactly. And that broad, rapid activation is really the key to its therapeutic power.
So if the whole system is lighting up, what's going on chemically? What are the neurotransmitters doing?
The chemical changes are pretty dramatic. And this is where we see the how for pain and stress reduction. Listening to music you actually like, your preferred music, triggers a release of dopamine.
The pleasure hormone.
The pleasure and reward hormone, right? And it happens especially in that anticipation phase, like right before the best part of a song you love. It also releases endorphins. These are your body's natural pain relievers. They create that feeling of well-being, and they actually decrease your perception of pain.
Which immediately explains why it's so good for relaxation, and I'm guessing it also tackles the other side of the coin, the stress hormone.
It does. Critically, music also works to reduce cortisol. That's the body's primary stress hormone. So by boosting the good stuff and lowering the bad stuff at the same time, you get this really powerful and very low-risk biochemical intervention.
And what's so fascinating here is just the sheer breadth of the processing when you look at brain imaging.
Yeah, exactly. Older theories used to link music mostly to the right side of the brain.
It's a creative side, right?
The so-called creative side. But modern imaging, it confirms bilateral processing. The brain works in harmony. So the right hemisphere, it's processing things like timbre, pitch, melody, the overall emotional feel of the music.
Right.
But the left hemisphere is processing rhythm and the sequential structures, the more kind of linguistic parts of the music.
It sounds like music is the perfect whole brain workout then. It's forcing this high-speed, synchronized communication between all these specialized systems.
It really is a conversation between the hemispheres.
Hmm.
And that deep activation of the limbic system, which, governs emotion and memory, that explains music's unique power to just induce well-being and provide this immediate outlet for emotional processing.
Okay, now that we have the neurochemical side down, let's look at the clinical results, starting with anxiety. This is a huge one for so many people listening.
The data here is pretty solid. A 2021 meta-analysis, so this combined the results of 32 different randomized controlled trials.
Wow, that's a lot of data.
It is. Almost 2,000 participants. And it found that music therapy significantly reduced anxiety compared to control groups right after the intervention.
We saw that metric in the sources, the standard mean difference, but what does that actually mean for the average person? Is it a small lift or a really measurable impact?
It's a measurable, moderate decrease in anxiety. So significant enough to be clinically meaningful. And a really key finding was about duration. The dose matters. Subgroup analysis showed that longer-term music therapy, so 12 sessions or more, it had a much larger effect than shorter interventions.
So consistency builds effectiveness. But here's where we have to be critical. This study also noted that the anxiety reduction didn't really last. The effect wasn't statistically significant at follow-up once they stopped the therapy.
And that raises a really important question. It suggests we should maybe view music therapy less like a one-time cure and more like, say, physical exercise. It provides huge benefits while you're doing it, but you need to keep doing it to maintain the effect. For chronic anxiety, ongoing MT seems to be necessary.
That is a crucial insight. Okay, let's move to depression, which so often comes along with other serious conditions. How does music therapy stack up?
It's a highly effective adjunct therapy, but what's really surprising is how it performs against its closest competitors, you could say. One comparison study found that music therapy was statistically superior in reducing depression scores compared to other art therapies,
Like what?
like painting, poetry, even creative play. Music therapy came out on top.
Wait, why do you think that is? What does music have that those other arts don't?
It's likely a combination of things. Music just has this unique, direct access to the limbic system. It connects to deep, primal emotion and memory in a way that, visual art or poetry might require a bit more conscious effort to get to. Plus, music is so often social, which is a key thing to combat in depression.
That makes sense. Now, within music therapy itself, there's a bit of a debate, right? Active versus receptive for depression.
There is. Active MT is often favored because it helps build those interpersonal connections, that social bond, which is so vital. You're creating something with someone else. But receptive MT, so the passive listening with guidance, that might actually be better for patients with really severe depression who might have very low motivation and are more passive.
So it's not that one is better, it just depends on where the patient is on their journey. It's all about personalization.
Exactly, and the benefits went beyond just mood scores. For these patients, MTC also led to measurable improvements in their general quality of life, QOL, and significantly better sleep quality, which is so often disrupted in depression.
Okay, let's shift gears now to physical and cognitive challenges. Let's start with dementia. This is such a pressing public health concern.
Dementia care is an absolutely pivotal area for music therapy. You have these behavioral and psychological symptoms of dementia. They call it BPSD, things like severe agitation, anxiety. Wandering, exactly. And they're extremely difficult to treat with drugs. A lot of the medications have minimal benefits and carry really high risks.
And the sources were pretty firm on their recommendation here.
They were. Music therapy is advocated as a first-line treatment choice, often over the use of heavy antipsychotic medication for these symptoms. That is a major vote of confidence from the clinical community for a non-drug intervention.
That's a huge endorsement. So how does it actually work? How does music help a compromised brain in a patient with dementia?
It's all about engagement and preservation. Music increases cerebral plasticity. That's the brain's ability to change and reorganize even late in life. It can enhance cognitive abilities like speech and memory. And what's really important is that music often taps into memories that are stored in these subcortical, nonverbal parts of the brain. Those memories are often preserved even when other memory centers are failing.
Which explains those amazing videos where someone can sing an entire song from their childhood, but they can't remember their own name.
That's exactly it. And personalization is absolutely key. People with dementia respond best when the music has personal meaning to them. For example, studies found that group singing had a greater impact on quality of life than just passive listening. Interactive stuff like clapping and dancing along also provided measurable benefits. You have to trigger those emotional circuits.
Okay, now here's where it gets really interesting for me. Pain management. We talked about the chemical side of pain relief, but is music actually strong enough to tackle physical pain in a clinical setting?
It is, but it's crucial to see it as a low-cost, low-risk adjunct strategy. It's not replacing heavy painkillers, but it can dramatically improve the psychosocial side of things and the overall quality of life during a painful experience. A big review looked at 44 studies, and 40 of them reported a reduction in pain levels.
So the vast majority showed a real benefit. What kind of conditions are we talking about here?
The applications are surprisingly broad. We see pain reduction in post-operative recovery. And get this, it was even effective when patients were under general anesthesia.
No.
Yes, it's used in dental procedures to lower pain scores tied to anxiety. It's been shown to help with labor and postpartum pain. The relief is usually described as mild to moderate, but it's real relief for patients dealing with really tough things like cancer or chronic kidney disease.
And just like with dementia, I'm guessing the choice of music matters a lot for pain relief.
It matters intensely, and the sources are really clear on the mechanism here. Music has a much greater analgesic effect if it's chosen by the patient themselves.
Why is that?
Because familiar, preferred music triggers those emotional and limbic mechanisms we talked about earlier. You get the dopamine, the endorphins, and that modulates the pain.
And what if you listen to music you don't know, unfamiliar music?
If you listen to unfamiliar music, say, chosen by a professional, the pain-relieving mechanism is mostly cognitive. You're basically just distracting the brain. You're forcing it to focus on complex auditory patterns instead of the pain signal. And that works, but the emotional preference just gives you so much more because you get that powerful neurochemical boost on top of the cognitive distraction.
That distinction, emotional versus cognitive pain modulation, that's a really powerful insight. The patient's own agency is paramount.
Absolutely. And, the structural evidence of music's impact, it just reinforces all of this. We have to talk about how music physically rewires the brain.
Yes, I want to go back to that idea of brain plasticity. What evidence do we have that musical experience physically changes the brain's hardware?
The evidence is truly fascinating. Active musical training, especially if it starts early, drives observable structural changes in the brain. For example, people who had musical training before age 7 show a measurably thicker corpus callosum.
And that's the superhighway, right? The massive bundle of nerve fibers connecting the two hemispheres.
Precisely. And a thicker corpus callosum means a greater speed of transfer and communication between the two sides of the brain. It means musicians can process these complex multimodal tasks like reading notes while moving their fingers and interpreting pitch faster and more efficiently.
What else changes structurally?
Musicians also showed a larger volume of gray matter, that's the tissue with the actual neural bodies, in the sensorimotor cortex and the occipital lobe, which makes sense when you think about it. Music is motor control, it's movement, it's timing. So the auditory cortex and motor cortex are firing together. The brain literally adapts by thickening those areas to support that combined function.
So active engagement with music physically shapes the speed and the volume of the brain's hardware. That's tangible evidence.
It's the foundation of neurorehabilitation. That's why music is so promising for things like stroke recovery, where you're trying to force the brain to reorganize its connections.
Okay, so despite all this really strong evidence, we have to acknowledge that the field still faces some challenges. What's holding the research back?
The main challenge is what scientists call heterogeneity. It's just a fancy way of saying the results are often hard to compare because the methods are all over the place. You look at these studies, and the variables are inconsistent. Who chose the music? What genre was it? How long were the sessions?
Oh, right.
A 30-minute session of therapist-chosen classical music is impossible to compare directly to an hour of patient-chosen rock music.
So that lack of standardization makes large-scale adoption a bit more difficult?
Yes, and it raises a really important point for the future. We urgently need more updated research using advanced neuroimaging fMRI, PET scans. These technologies will let us see the benefits with far greater precision, and that will allow us to finally start standardizing interventions based on hard neurological data.
So what does this all mean? We started out by asking if music therapy is a viable, evidence-based intervention, and the answer, even with some of the older methods, seems to be a resounding yes.
It is. We've seen that music therapy is so much more than background noise. It's a measurable intervention. It physically stimulates pleasure, memory, and motor control circuits in the brain. It achieves significant reductions in anxiety and pain.
And it offers this crucial non-pharmacological pathway for conditions like dementia and depression.
Exactly.
So the key takeaways for you as the listener are pretty clear. The power of personalization is just immense. Self-selected music is demonstrably more effective. It's measured as being statistically superior to other creative arts in treating depression. And maybe most powerfully, we have evidence of these tangible structural changes that early musical training gives the brain, enhancing the communication speed between the hemispheres.
It really reframes music as a tool for physical and cognitive health maintenance, not just as entertainment.
It certainly does. Which leads us to our final provocative thought for you to mull over. If structured musical training causes an increase in the volume and speed of the brain's main communication pathway, the corpus callosum, especially when it's introduced before age 7, how might routine, structured musical engagement throughout your entire adult life continue to build cognitive resilience and neural connectivity? Could it be a form of proactive maintenance for the brain's physical hardware?